My story starts after I started the medical school. In fact, within my first year in medical school, I fell in love with medicine. I became more and more aware that this is probably what I had always wanted to do or should have been doing, and never looked back. They will have a full physical exam, review of the lab works, any other tests done in the past, and then we will come up with a plan of management. And I will sit down and talk to them and spend as much time as needed answering all their questions so their anxiety is taken off. And I think that spending time and listening to them is probably the most important part of what I do. So I can assure you that if you are coming to see me, you will get my full attention. And this is what my patients deserve. The most common heart rhythm problem I see in my practice is atrial fibrillation. There are so many risk factors that include high blood pressures, uncontrolled diabetes, obesity, obstructive sleep apnea. The biggest risk of this problem is that it can go undetected for years, as patient may not have any symptoms, but the risk of stroke is the biggest issue in patients who have atrial fibrillation or silent atrial fibrillation. Detroit is home. It is my city. So, I think that when I take care of the people, Detroiters, I'm a Detroiter. They're my people. If we have a common patient or if they send me a new patient, I will be always available by phone. I'm just a phone call away. The referring doctor should get a note from my office which will be outlining what I thought about the patient's issues were, what my plan is, and what my recommendations are. Most of my patients, they are pretty complex. They have 2, 3, 4, 5 medical issues, and they are sent to me with one particular medical problem, which I cannot take care of in isolation. So everything has to be taken care of in a concert, in a cohort. I always rely on my referent doctors, my primary care doctors, that we work together in the long run for the benefit of the patient.